it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
A Tale of Two Hygienists presents this week's tip-episode. Mini episodes giving you the tips to be successful, delivered straight from the experts. This week, sponsored in part by GC America. Welcome back, everyone, into this week's tip-episode, brought to you in part by GC America. I am your host, Andrew Johnston, and thank you for joining me this week. I thought that I would take a little bit of time and talk about some maybe different or unique patient management cases. So we'll start off by talking about those really grumpy patients that we have. I want to talk about teenagers. I want to talk about patients who are deaf and patients who are blind. Now, to be really clear, I'm not an expert in any one of these things, but I do want to tell you about my experiences with them. My hope is that when you hear some of these words, maybe you'll go out and you'll be more prepared for your appointments. Maybe the appointments will go a little bit more smooth. And we're just going to address the needs of these sometimes unique situations. So let's start off by talking about those grumpy butt patients, right? The kind that are just they're never happy. So they come in, they got a scowl on their face. First thing they say, you better not give that cold water to me. But you already read your notes, right? So you know that you're going to be putting some hot water in there ahead of time. But as you're going through your appointment, of course, it's not warm enough. That seat's not comfortable enough for them. The office temperature is too hot, but also too cold for them somehow simultaneously. They're never happy with anything. Now, one thing I will say is, I think I've said this before, it's a double-edged sword to read those patient notes or the patient alerts before the appointments, right? Because you're probably bracing for this appointment, knowing who's coming in. But that's the conundrum that we face. We still need to be professional. We still need to do our job. And part of that job is giving home care instruction to someone who probably doesn't want to hear it. I was reading a little bit online. There is a website, it's called kevinmd.com, and it's a pretty popular site for physicians. And one of the articles that they have was talking about essentially 4 main causes for patients to become angry. And they suggested that if we know why patients are angry, then maybe we'd have different results, or maybe we'd actually get the results that we're looking for. So I'm going to share kind of what they wrote and then fill in kind of some blanks with my own thoughts. So the first thing that a patient might be angry about is because they're in pain. If the patient shows up to our offices, however, because remember, this article is written for medical practices, oftentimes it's going to be dental related pain. However, they suggested though that it might not be dentally related. They might be in pain somewhere else in their body. It could be physical, it could be emotional. We don't know these things. So that's the first one. Now, the second reason a patient might be angry is because of fear or worry. And what possibly could they have to be worried about or scared about in a dental office? Well, maybe they're just dental phobic. I had a patient last year. I had sat her down. We'd already done the period charting. We've already done all these things. And before I could really even get into the treatment plans or the scaling and root planing, she whipped out her checkbook really quick and she showed me the balance because, of course, yes, she was older. Yes, it is Florida. Yes, she was balancing her checkbook. And she let me know exactly how much money she had in the bank account. She said, Andrew, I can't do probably what you're going to tell me to do. Now, again, she had no idea what I was going to tell her yet. Maybe she heard the numbers from the period charting. Maybe she had a little bit of inkling what was going to happen, but she was over it. And so sometimes there's fear and worry that really is crippling for these patients. Also, maybe they're going to be worried that they're going to be judged on their lack of home care. Maybe it's their appearance, maybe it's their clothes, maybe their shoes aren't in style, or any number of things that they're afraid another human being is going to make fun of them about or talk about them behind their back. Discovering these types of things will lead to better compliance for sure, if that is the reason. Now, the third reason they said from the article is feeling unheard or uninvolved. If anyone was watching Scrubs or ER, you could easily see how this might happen, especially at a teaching hospital where they bring in all sorts of characters, all sorts of doctors to look at special cases. Having a patient wait too long in our waiting rooms or in our chair can trigger some of these feelings of feeling unwanted, feeling neglected, feeling unheard. And so making sure that we value them and show them that value by not making them have long wait times, really listening to them as they're describing their pain or concerns or any of those things. And the fourth reason they said was an unidentified medical condition or psychiatric disorder. And they said this could be due to a lot of things, namely medications, or they skip their medication, they miss their schedule of medication. They could also be going through with some withdrawals, whether alcohol or other addictive substances. It could be a whole myriad of things. And I can't stress this enough. I mean, these are just 4 main reasons. But I think if you have a conversation with these patients, try and understand them, be listening, and then become an advocate for them. Show them that you're on their side and you're going to get the results that you're looking for as far as improving their health. Now, let's focus on some tips for managing teenagers. In my experience, you have several different types of teenagers that show up in our chairs. You get the quiet ones, maybe they're a little bit shy. You got the super confident ones, the loud attention seeker one, that crybaby one, and then all of those ones in between. Now, because we don't have all day to talk about these one by one, I did a mini interview with my oldest boy, Zach, age 16, as to what bothers him the most about what we do. And hopefully this will give you a little insight about teenagers and their attitudes and behaviors. He said his least favorite part is when they take that little metal thing and scrape the plaque off the teeth. He gets why they do it, but it's uncomfortable. I asked him to explain what uncomfortable means. And he said, it's just a weird feeling on my teeth and towards the gums, especially, like sometimes it will hurt a little bit. I asked, does the gum tissue hurt or the teeth? He said, it's more like the gum tissue. I said, does it hurt when they polish also? He said, no, not really. I asked him, was it me when I cleaned your teeth? He said, I don't really remember it being you, but I feel like it happens every time. So maybe, which I think was his nice way of saying like, no, Dad, it's not totally not you, but wink, wink, it is. So then I asked him, well, what do you think that you could do to make it a better experience for yourself? He said, I honestly don't know. And then typical dad, I said, well, what about making sure you don't have plaque on your teeth in the first place? And he said, well, that's true. Preventing the plaque in the first place. I said, what else bothers you? He said, pretty much nothing. I said, do you prefer someone who talks to you a bunch or someone who is quieter? He said, no preference. I said, do you feel like you get lectured to? He said, I feel like a little. He said, I feel like for flossing and stuff, which is definitely my fault, but that's pretty much it. So as you can see, he's basically no help. So in order to solve this, I went to my almost 15-year-old boy, Hiram, and I said, Hiram, what bothers you most about going to the dentist? He said, nothing that I can think of. I said, you don't get a pit in your stomach every time we tell you it's time to go to the dentist? He says, nope, not really. And so he was no help either. Now, the thing that's interesting about this is I was thinking about their experiences versus my experience of getting cold sweats, dreading that long lecture that I know is going to happen, the inevitable guilt that I was going to feel for not ever being good enough for brushing or flossing. And it really seems to me that teenagers' attitudes and behaviors are likely instilled in them when they're younger. Because I had all of those things, therefore I had dread as a teenager and as an adult going to the dentist, but they didn't have those negative experiences as children. So now as teenagers, they don't necessarily have them as well. But the root cause of this is that this is all because of how we treat them when they come in. We are controlling our future or their future. And so if you're seeing a teenage patient this week, I would love for you just to ask them about their experience in the dental office as a child. Prove me right or wrong on this theory, because it might give you a little bit of insight. And you can probably adjust your conversations and the education that you give around how they act, how they react to your words. Because using disclosing agent on one kid will be a really fun, it's really cool. There's an experiment. It might be a bit of a game. They're going to win. Like if they have just a little bit, they're going to be so happy about this. But then for those other ones that might see 2 or 3 pink spots in the whole entire mouth, they're going to feel so bad about themselves that they did so poorly on this quote unquote exam. And knowing that that could be a possibility, instead of just going in and jumping into disclosing, talk about it first. See what they think. So beyond all this, my best tip for teens is just to love them. If they have a good home life, they have supportive friends, it's likely they're going to be happy to be there and they'll be happy that you're being nice to them. But if they don't have the best home life outside of the operatory walls, they will really appreciate that someone cares enough to talk to them about this, that someone cares enough to show love. Okay, moving on because we are halfway through and I don't speak fast enough. So I had several patients back in Washington who were deaf. They always need an interpreter, which by law they are entitled to. And I was really lucky enough to have the same 3 people come into the office for signing. And probably I need to do a whole tip episode on this topic another time because I have just so much I want to talk about. But a quick few thoughts. First, if your clinic has the ability to have those masks that are see-through in the middle where your mouth goes, get a box or two of them and stash them in the back. Many of my patients could read lips, and unfortunately, I did not have one of those masks. So I would often do the pull down the mask thing, talk, and then put my mask back up, which, as we all know, is an infection prevention and control nightmare, breach of protocol, all of the different things. Another thing that I learned was whenever you're talking to the patient, always have them sitting up most of the way. So 45 degrees to maybe like 85 degrees, not all the way up because that's sometimes uncomfortable, but just enough so they could see the interpreter also sign what I was saying. One of my patients even taught me that it was easier for me to roll my seat around or even go stand by the interpreter as I was speaking, because as I was talking to her, she was trying to read my lips and then would have to turn her head to find her interpreter doing ASL. And so that wasn't convenient for her. And she said if I stood right next to them, then she could just dart her eyes back and forth and keep up with the conversation better. Because whether you think that it's true or not, a lot of them that can read lips prefer to read lips because it allows them to connect with you as a provider. And then as far as home care goes, there were actually some notions the younger patients did not understand, some of the words that we use, things like that. And the interpreter also didn't know how to sign them. So just be wary of that. It's not a big deal. In fact, I kind of actually suggest that you do approach those as learning opportunities. So you're going to have to learn to be comfortable with everyone staring at each other, not knowing how to say the word. But think back to when we learned some of these words in hygiene school, and then the next day we had to define them on a test, and we're just like that deer in the headlights feeling. Now, we overcame that. We learned it. And honestly, they want to be challenged too. They want to learn new things. So I love the opportunity to find a connection. And think about this too. If you spend just a few of those minutes discussing this in further detail, they're never going to forget you the rest of their life, right? You're going to have that bond with that patient, and they'll always remember that about you. When I worked in Washington, our clinic had a contract with several groups in the area. One of them was for the state's School for the Blind. And up until that time, I'd never really treated anyone who was visually impaired. And so that Tuesday morning, I'm never going to forget this. When Hank came in, obviously I changed his name for the purpose of the podcast, but when Hank came in and I was totally caught off guard. I didn't see the alert. I didn't see the note. He carried with him a Braille version of the Wall Street Journal. He had his cane in his hand. He was escorted in by the dental assistant who actually knew him from a previous appointment. But unlike other groups, he was completely alone. There's no caretaker. There's no one else by his side. He took the bus to get in. In my inexperienced mind, and by inexperienced, I mean just inexperienced with this particular group, I'd been practicing dentistry for a while. I'd never encountered this before. I was just so curious as to what I'd find and a little bit apprehensive because I expected lots of decay, lots of obvious areas of missed plaque in calculus, probably rings of calculus in areas. I didn't imagine any kind of interproximal cleaning was happening. And I was kind of bummed because I jumped to conclusions. I assumed also that if we had anything like a triplaque gel or other disclosing agent as a teaching aid, obviously that's not going to have any benefit here. And that's pretty much what we rely on as a profession for standard patient education. So show, tell, do would be missing a huge component. And man, if he presents with a bombed out dentition, how will I adjust my education to get him to really understand? Well, my worst fears were not realized. Hank had incredible home care. He was actually an educator at the school, and he told me that he really enjoyed going to the dentist and taking care of his teeth. He used string floss. He had a water flosser. He brushed twice a day, sometimes a third time after lunch. He told me that he felt that so many people were always staring at him with his sunglasses and his cane that he wanted to be the person that brightened up their day. He wanted to be the person that was always flashing a smile everywhere he could, and he couldn't do that if he didn't have a healthy smile. And I never forgot that. And so the tip from this part of the episode is simply that whatever preconceived notions you might have about treating someone who has a limitation in some regard, it's incredibly unfair to think that. And just because I had a great experience with Hank, the Hank that visits you in your office might not be so healthy. You just have to treat everyone according to how they present and don't have the preconceived notions. It's just not helpful. Lots of groups have special home care needs. I mentioned in this episode at the very beginning that it's brought to you in part by GC America. I couldn't be happier that they sponsor so many of the things we do. I feel comfortable with their line of products because it addresses the needs of just about every kind of patient that walks through our doors. Most of you probably heard about MI Paste. Well, they have a new MI paste. It's called MI Paste 1 Perio, which is an anti-gingivitis paste with bioavailable calcium, phosphate, and fluoride. You also might know that as Recaldent. Thinking back to the groups I spoke about today, there is an MI paste appropriate for each and every one of them. It's one of the reasons, again, that I just love working with GC. They also have some of the most amazing lunch and learns, so be sure to check out their website. I'll put it in the show notes, the website that you can go to request a lunch and learn for your office. Thank you so much for listening today. Thank you so much for your patience in treating a diverse group that you do treat. If you have questions or comments, please shoot me an email, andrew@atale2hygienist.com. I read every single one of them. Stay positive, stay educated, and we will talk to you next week.
A tale of two hygienists.